Hello, my name is Dr. Carl Michel. I am a practicing foot and ankle surgeon at Genesis Foot and Ankle Institute, as well as board member of T.D. Ward Jefferson Medical Society, where I currently serve as parliamentarian, health fair, and health education chair. T.D. Ward Jefferson is made of healthcare professionals dedicated to improving the health and wellness, access to care, academic and career opportunities and the quality of life of our underserved populations through the provision of healthcare, education, career exposures, and youth development services. Thank you for electing to take this opportunity to learn. We hope you find this offering valuable in your everyday life. If you would like more information on T.D. Ward Jefferson Medical Society, please visit our website at tljmedicalsociety.org.
Next, in our series on opioid education, how physical therapy is so critical in the fight.
And if we are not, as medical practitioners, able to get that patient out of those early phases of pain, then we can expect for them to stay dependent on those opioids, which is bad.
And a natural approach to pain management.
There's certain foods that reduce inflammation, and there's certain foods that have been known to reduce pain.
And it's all right there in the grocery store.
The education will allow them to know what foods to eat and what foods to avoid.
I'm Sandy Collier, and thank you for joining us on this session. I have with me Dr. Brandon West. Dr. Brandon West is a therapist, physical therapist.
Yes, ma'am, I am.
Why don't you tell us a little bit about yourself and your practice, doctor?
Okay, well, where I began, I'm from Pahokee, Florida. I set out as a young kid wanting to help other people, especially my teammates. From that point, my father just he was browsing around and he ran across a fellow coworker that happened to be a physical therapist, and he made a suggestion to me that it might be something that I may be interested in because of the sports, and I like to work out and I like to help people, and I would often walk my grandmother to keep her mobile. So as I grew older, I started doing my volunteer hours and definitely sought out to be a physical therapist. So went to Florida A&M University, where I ran collegiately, but also chose Florida A&M because they had a pre-physical therapy program. And while I was there, it actually converted into a doctorate program. So I did both my undergrad and my doctorate at Florida A&M University, and came back home.
And now you have your own practice?
Yes, ma'am.
Where are you located? Tell us where you're located.
Well, I am located throughout Palm Beach County and also St. Lucie County. What I do is I contract with facilities as well as agencies to provide physical therapy services. I just kind of like to spread my wings as wide as I can so that I could, kind of touch a little bit of everyone. So I practice within home care and definitely outpatient. I have also done some care in acute. So,
well, let's talk about that. Tell us a little bit about your background in treating patients who are experiencing pain.
Okay. So as a physical therapist, we will work in all types of settings. We can work in an acute setting. We can work in outpatient settings, skilled nursing facilities, as well as home care. And within each of those settings, we will encounter patients that have pain. Typically about 90 to 95% of them will present with pain. Therefore, we have to be pretty well-rounded as for screening those patients and seeing how we can help them. As I stated, in an acute setting, we'll encounter patients in the hospital that have suffered severe burns. They have wounds. We see them preoperative, postoperative. We get a wide variety of different types of patients presenting with their own type of pain. So being that, we have to know how to actually treat those patients. In an outpatient, we'll encounter patients that have a lot of low back pain, neck pain. So joint manipulations become involved, soft tissue manipulation where we break down that tissue. So I like working in all of the settings because I like to be well-rounded. I like to be able to reach everyone at their own individual level and just kind of see if I can impact them in a positive manner.
Let's talk about, you explained just now what acute setting is. What is subacute setting and chronic pain?
Okay.
What's the difference?
So, well, we have acute pain, we have subacute pain, and then we have chronic pain.
Okay.
And when it boils down to that, acute pain lasts for a certain period of time. Each pain level lasts for a certain period of time. Acute pain lasts anywhere from initially 0 to 5 weeks. And within that realm of pain, what we're trying to do is manage the pain, the inflammation, and basically prevent that patient from re-aggravating that issue. Whereas subacute, which is a subset of acute, it will last anywhere from 6 weeks to 3 months. Okay, and within that realm, we shift our focus of treatment. So we're still focusing on pain management. We're still focusing on inflammation and keeping edema down, but we're also carrying over into another phase of range of motion. We may still have them in a splint, but when they come in to see us, we'll mobilize, we'll actually break down the soft tissue to a degree, and we'll promote more blood flow. I forgot to mention earlier in the subacute phase, we're focusing more on cryotherapy, where we're utilizing a lot of ice so that we minimize the inflammation. In the subacute phase, we'll do contrast therapy, where we utilize ice and heat so that we actually bring blood flow to the region, promoting healing and actually helping carry that patient over into the next phase of healing to prevent what we call chronic pain. Chronic pain is long-lasting. It can last for months, years, lifetime. So what we like to do is basically treat that patient or that region of area as best we can by either breaking down the soft tissue if they have any muscle imbalances, by treating the joint to stabilize it, getting them out of those splints so that we can improve functionality. Chronic pain, it can be challenging because it can fall into more of a management stage where we can't get that patient out of pain, but we still try to make it to where that patient can at least have a quality of life while still dealing with their deficits or issues.
How important is taking a patient history and knowing how to best relieve their pain?
Okay, so whenever a patient comes in, we have to be very thorough when it comes to getting their history. Within that history, we'll find out a number of things that will help us differentially diagnose what may be going on with that patient. If a patient comes in, we're going to find out what was the mechanism of injury, whether it wasn't an actual injury that occurred or whether or not that patient doesn't have an injury, is something more systemically going on. When we take that history, it actually allows us, it gives us the ability to know whether or not we can help that patient or if we need to refer that patient out to another discipline that may be better suited for that patient. So within that medical history or that assessment, we'll get a history. We'll also do objective measures where we administer different type of tests. We'll record baselines of range of motion. We'll record baselines of muscle strength. And from that, what we'll formulate is our assessment. What's going on? So we got the history, we got the objective. Now, what's going on with this patient? Further, we'll go on to discern what that patient's diagnosis is, what their prognosis is, which is how well will they do with physical therapy, and we'll create short-term and long-term goals for that patient. Okay, from that, we have a baseline, and we'll do a reevaluation to see how that patient has progressed. But when we sit down and we take a history, we're doing a number of things, basically to get the optimum plan of care written up for that patient.
Doctor, what is the gate theory, and can you explain how it applies to pain management?
Okay, so the gate theory. Gate theory is a very interesting concept. It's been with us for years, where scientists, especially neurological doctors, they figured out how the nervous system conveys pain to the brain from the body. So we have nociceptive receptors in the body that actually sends that signal up to the brain via the CNS, which is the central nervous system, also known as the spinal cord. Okay? And what the gate theory has taught us and allowed us to be able to do is override the sensation of pain being sent to the brain. So what we'll do is we'll give, or it basically render, a non-painful stimuli to that patient to override that painful input from being sent to the brain. Does that make sense? So we can use ice, right? Heat, electrical stimulation, ultrasound, and a slew of other modalities to actually block the sensation of pain. We also like to use, which everyone may be familiar with, is topical analgesics, like your Biofreeze, right? Voltaren cream. What that does is create a sensation on the skin surface where you can't, it's not painful, but you actually feel the sensation of that menthol, that cooling, that actually overrides the signal of that pain as well, so that that pain signal never makes it to the actual cortex of the brain.
So, doctor, what are some techniques that physical therapists use to reduce pain and promote healing? You just started talking about some of them, the topical creams, but what else?
So, you have 4 types of pain. You have nociceptive pain, you have inflammatory pain, you have neuropathic pain, you also have functional pain. With those pains, you have to make sure you screen for those, because that's going to dictate what that patient will be treated for. That'll let you discern whether or not it's muscle pain or joint pain. Nociceptive pain is related to tissue injury. It can be chemical related. It can be mechanical related. It can even be thermal related, such as touching a hot stove and burning yourself. With that, you'll know where that pain needs to, what you actually need to treat when you're treating that patient. So, as physical therapists, what we're capable of doing is normalizing that tissue that may be impacted. If it's muscle, we're gonna check and screen for any muscle tonicity. That's the tone in that actual muscle group. If there's tone in a muscle, we can also expect there to be tension on a tendon, which will lead to a couple of things, right? Muscle pain and also tendon pain, which is going to be our tendinitis. So what we'll have to do is normalize that muscle by doing actual soft tissue breakdown, right? Restoring the balance. If we restore the balance in that muscle, we can also expect for that tension on the tendon to be reduced, which will allow that tendon a break, right? Because tendinitis actually comes from overuse of muscle or tendon. So if we reduce the tension on that tendon, we don't have to worry about that tension remaining under constant pressure, and it allows it to rest, okay? As for joint pain, when it comes to joint pain, if you have a particular muscle group that's tighter, like let's say the front of the leg is tighter than the back of the leg, and it creates a muscle imbalance over that joint, now you have to worry about abnormal wear, right, on the joint, which will lead to like an arthritis, a meniscus issue, or even while being functional, you can create a torsion on that joint to actually tear ligaments. So when we're treating pain, we're trying to pick up and we're differential diagnosing what type of pain may be occurring. If there's a neurological issue, neuropathic, we're going to expect to see like a burning or a tingling, a numbness, and we'll know, okay, well, this is a neurological sign that we're getting. It could be the spine. It could be a vertebra that's rotated out of position, so we have a pinched nerve, right? So what are we going to do? We're going to improve that alignment so that we can take the tension off of the nerve and thus reduce that neurological pain that that patient may be experiencing. So it all boils down to those types of pain that the patient is experiencing, and that actually lead us to our particular type of treatment. That's how we basically derive our plan of care.
Doctor, how does physical therapy help to reduce opioid dependency?
Okay. So what we have to take into consideration when it comes to opioid dependency is people are taking those medications to reduce pain, right? And as we stated earlier, you can have acute pain, subacute, and chronic pain. Initially, they'll take pain medication because they are in an acute situation, so they will take it. And if we are not, as medical practitioners, able to get that patient out of those early phases of pain, then we can expect for them to stay dependent on those opioids, which is bad. That's when it boils down to us trying to backtrack to get that patient out of a situation. So I think what we need to keep in mind is making sure that that patient receives adequate care throughout their entire phase of what they're going through, be it falling off of a bike to having surgery. You have to make sure that that patient is being progressed appropriately through those phases of pain or injury. So acute pain, subacute pain, and trying to prevent that chronic pain. Because once it reaches that 6-month mark and then turns into a year, now we're talking about reversing years of scar tissue, adhesions, and habits. Because a patient, they'll develop that as a habit of taking that medication to basically take care of their issues.
Can you explain how, can you give us an example of how physical therapy has helped one of your patients experiencing pain to recover and now doing a lot better?
Yes, I have quite a few. I have some stroke patients that went through a ton of issues where they just didn't obtain adequate muscle function. So whenever there isn't an appropriate muscle function over a joint, you're walking on or you're performing functional movements on that joint where there's an instability. And as we said earlier, there are nociceptors on the surface of joints that will relate pain up to the CNS. So rehabbing that patient to improve overall function is a pretty excellent thing. So what I've encountered was a stroke patient. She suffered a stroke maybe 4 to 5 years before I actually met her. And the care that she described to me that she was receiving, there was care, but it wasn't advanced. And that's where it boils down to reevaluating and really communicating with your patients, having that clinician-patient rapport, because they'll tell you everything you need to know. So what I was able to do was improve her physical function and increase muscle tone and strength to reduce her from the lack of quality of life, but then also the pain that she was experiencing because she didn't have adequate joint range of motion. She didn't have adequate muscle strength to mobilize her body. So she remained dormant in a chair for a long period of time when she didn't really have to. So that was a really good experience. And then
Let's talk about a patient that was on opioids.
Okay.
and through physical therapy help them to get past that dependency that may have or could have led to addiction, and getting them off of that.
Okay, so I've had lumbar patients that underwent surgery where they may have gotten a fusion or they may have gotten a laminectomy, discectomy. The surgery went perfectly fine. However, the patient still didn't receive adequate post-operative care. So they come in and they have extreme myofascial tightness, muscle tightness, and a lack of mobility of the spine. And one of my patients I can recall vividly just breaking down that soft tissue and the scar tissue that's associated with that surgery that wasn't treated appropriately, unfortunately. Once we were able to break through the actual tissue that was causing the pain and improve the overall core strength, this patient was able to actually come off of all medication and actually, live a quality life following. So, my advice, if you are having any type of pain, you don't have to live with that pain. A lot of us feel like, it's just a little pain. I don't want to come off as if I'm being, soft or, bothersome. Seek care, because in the medical realm, we all have our own disciplines for a reason. And just remember there are practitioners out there that can help you achieve, that quality and pain-free life where you don't have to depend on medication to, get through your daily routine.
Dr. West, if you had the power to change anything in terms of helping to combat the opioid crisis, what would that change be?
What I would say is if we can reduce the amount of medication that we're actually prescribing for pain and let's try to get the patients referred out to more conservative type care before we just rely on stronger doses of medication to help these patients seek their way through.
Doctor, you have a lot of your colleagues in the audience, and before we say goodbye, what advice do you have for them?
Well, my advice to my colleagues of the medical field would be, at the end of the day, let's keep our patients first, and let's see if we can render the optimum level of care to help them seek quality life.
Dr. West, thank you so much for being here. We had a wonderful conversation. It was a pleasure to sit and chat with you.
Oh, my.
I'm Sandy Collier. Until next time, take care of yourself and each other. Thank you for joining us this evening. I'm Sandy Collier. And with me is Dr. Chris Thompson. Dr. Thompson, thank you so much for being here. And you are in chiropractic, right?
Yes, I am.
So let's tell us a little bit about yourself and your practice.
Okay. Well, to start off, we'll go over a little bit about my education. I went to the University of Florida for undergraduate.
Okay.
I graduated from there. I went to Texas Chiropractic College, and I graduated from there in 2003. I started working for a company down in Miami for the first 7 years, and I've had my own private practice for the last 10.
And where exactly is your practice located?
We have 4 locations. We have one location in Riviera Beach, right on Blue Heron, right west of I-95. We have one location out in Belglade on Main Street across from the old hospital. We have one location down in Delray at the corner of Military and Atlantic. And then we also have one in Wellington in the Palomino Park.
Okay, wonderful. So let's talk a little bit about your background in treating patients who are experiencing pain.
Okay. I've been treating patients for approximately 17 years. Most patients come to see us because they are in pain. We treat patients who've been involved in automobile-related accidents, work-related accidents, slip and falls, and just patients who just are generally in pain.
What are some of the underlying biological reasons why someone might be experiencing pain? And you just started to touch on that a little bit.
Mm-hmm. Well, Some of the reasons why a person may be experiencing pain, it may be because of inflammation. Inflammation is one of the main reasons why a person experiences pain. And inflammation can be caused from a number of different reasons. One reason why inflammation is caused is tissue damage, and that's the result of like an accident or a fall. When you damage the tissue, swelling will occur, and then pain will proceed after that. Nerve irritation is another biological reason for a patient experiencing pain. Nerve irritation can come in several forms. It can be mechanical nerve irritation, meaning like pressure on the nerve or a pinched nerve. It can be like a chemical irritation, like a poison or a venom. It can also be like a thermal irritation, like excess heat or excess cold. Those things can also cause pain.
So, doctor, in what ways can chiropractic care provide an alternative to opioid medications for pain management?
Okay. What we do as chiropractors, we try to approach the patient and the patient's pain in a whole body approach. We try to separate the mental from the physical. So we start off by approaching the patient's mental aspect to the pain. When a person is experiencing pain, their body will have a similar response to as if they were under a lot of stress. So what tends to happen is the body will release stress hormones into the bloodstream, which will cause the blood pressure to raise, the heart rate to raise, and the muscles to go into a state of tension. Over a period of time, this leads to to inflammation, which leads to more pain. So we try to address that side of it by trying to get the patient to relax, which will cause a decrease in the heart rate, a decrease in the blood pressure, and a decrease in the stress hormones that are in the bloodstream. And we do this by using specific techniques. One technique that we use is a deep breathing technique. Okay. What that is we call it like the 4 square approach. So a patient will take a deep breath in, counting to 4. Once they get the breath in, they'll hold it for 4 seconds. Expel the breath for 4 seconds, and then hold it out for 4 seconds. They'll do this for a series of 10 times. Okay, and that has been shown to relax the patient, decrease the heart rate, decrease the blood pressure, and to decrease those stress hormones. We also have them, it's called visualization. So we'll have the patient either sit or lay down and visualize that they're in a relaxing setting, whatever's relaxing to them, whether it's a beach, whether it's at church, or a place where they feel comfortable and relaxed. And we try to have them experience how they're feeling when they're there, but at the office. So they try to experience the smells, the sounds, the feelings of them being in that relaxed state. That reduces the blood pressure, reduces the heart rate, and reduces those stress hormones. So we try to get them to work on that side of it first before we work on the physical side. So once we've gotten the mental side down, we also can ask them to do some meditation techniques. So we have them lay down, take some deep, slow breaths, and try to erase their mind from all thoughts and just concentrate on being there and being in the moment. We have them do that for about 10 to 15 minutes. This also relaxes them, reduces the heart rate, reduces the blood pressure, and causes those stress hormones to decrease. Once we're done with the mental aspect, then we can address the physical. With the physical, we try to, if it's an acute situation, we try to use acute modalities. Acute modalities will include ice, which just numbs the area and reduces inflammation. We also use a modality called a TENS unit, and that is transcutaneous electrical nerve stimulation. It's just nerve impulses to the peripheral nerves to fatigue them. Once the nerves get tired, they receive the pain signals less, and they're less likely to transmit them through the spinal cord and up to the brain. These nerve impulses also stimulate the body to release endorphins into the bloodstream. These endorphins also decrease the pain sensation.
So, what are some of the homeopathic therapies that chiropractors use for pain management?
The homeopathic therapies that we use, we recommend that the patients take these. They're more like remedies, homeopathic remedies. One of the main ones that we use is called arnica. Okay, they sell this at Whole Foods store. They sell it at Walgreens as well as at Amazon. It's great for pain. It's great for inflammation. Okay. We also recommend that you eat a diet that's high in like ginger, green leafy vegetables, berries, fruits, things that have anti-inflammatory properties. When you eat these things, it reduces the inflammation, which in turn reduces the pain.
So, doctor, when I think of going to the chiropractor, I think about my bones being cracked. Okay. Let's talk about adjustments. What is chiropractic adjustments?
Okay. What the adjustments is, the bones should be in a nice straight line, the vertebra. Sometimes they'll go out of alignment, meaning they'll go to the right or they'll go to the left. What we do is we gently push the bones using our hands back into a nice straight line. You may feel or hear a pop or a click, but that's just a change in gas pressure. But the purpose of the adjustment is to take the pressure off of the nerve. The nerve is what's feeling the pain because it's being pressed on. When we adjust you, we take the pressure off the nerve, which relieves the pain.
We started talking about a healthy diet. Why is a healthy diet so important in able to control chronic pain?
When you have, a lot of times when a patient has chronic pain, it's because of tissue injury. A healthy diet will ensure that the body has the right substrates to do tissue repair. The faster the tissue is repaired, the faster the pain goes away. It's also important when having a healthy diet to keep in mind what foods to leave out. Okay, so not only what foods to take in, you have to remind yourself what foods you want to leave out. The foods you want to leave out are the foods that causes more inflammation. These are going to be your processed foods, your fast foods, foods like potato chips, like pretzels, like your carbohydrates, your sweet drinks like sports drinks, like sodas. Those things, they also cause inflammation. You want to try to leave off your processed meat, like your hot dogs, things like that. You want to try to eat nice, fresh vegetables and fruits. And if you are going to eat meat, make sure that it's going to be fresh meat and not processed meat.
So I can hear a lot of people, and even including myself, saying, well, I can't have a hot dog anymore. But that's not what you're saying.
No.
What you explain what you're saying so people can take it in the right context.
In having a healthy diet, that does not mean restricting all foods that are not necessarily the best thing for you. You have to have a nice, well-rounded diet. So you can have things like hot dogs, you can have things like bread and processed foods, but in moderation. You can't have a lot of it. You have to have it in a limited amount, and you can't have it every day. You can only have it, a couple of days a week maybe. So a nice healthy diet means well-rounded, means not restricting yourself to a point that you won't be able to maintain it. You have to do things and eat things in moderation.
What are some foods that are beneficial for reducing opioid dependency? And that's an interesting question. Let's talk a lot about that.
So in order to reduce the opioid dependency, you need to reduce the pain. So and pain is very subjective. Again, each person feels pain differently. Just like every person is a unique individual, every person experiences pain differently.
Right.
People have different pain tolerances. So to answer that question, there are certain foods that reduce inflammation, and there's certain foods that have been known to reduce pain. So we'll start off with the foods that have the anti-inflammatory properties.
Okay.
Those are going to be ones that are like your green leafy vegetables, lettuce, greens, kale, things like your berries, like cherries, blueberries, Those things have antioxidant properties and anti-inflammatory properties. You want to eat meats like that are lean and have omega-3 fatty acids, which would be meats like salmon, meats like tuna, and you want to stay away from your other meats that may be a little bit more fatty in nature.
Like steak?
Like steak. Yes. Let's see, some of the other foods that have those good anti-inflammatory properties, avocado is one as well. Pumpkin seeds, they have anti-inflammatory properties. All of these are very good for you to include into your diet.
So I'm fascinated by what we're talking about. So this goes into our next question of the importance, how important is the role of health education in the community to help people manage their chronic pain in more effective ways other than relying on opioid medications?
The importance of education is vital in, helping the patients to manage their pain and to decrease their dependency on pain medication. The education will allow them to know what alternatives exist other than taking pain medication. The education will allow them to know what foods to eat and what foods to avoid. The education is critical in them being able to be active and take a part in managing their pain.
So, Doctor, you talked a little bit about some of the foods. Other than berries and steak, what else are some of the foods that we should be eating to help?
Okay, some other foods that have very good anti-inflammatory and pain reduction properties are like chili peppers. They have anti-inflammatory and pain reduction. Dark chocolate and cocoa, green tea, mushrooms. They all have properties of anti-inflammatory and pain reduction. So if you include those in your diet 2 or 3 times a week, it definitely helps in reducing pain levels.
So, Dr. Thompson, I know you have a success story of a patient that you've helped from, I think we're talking about when they had an accident and they were heavily dependent on opioids, and now through behavior modification, food, diet, they're better.
Okay. We definitely have a lot of success in dealing with patients who are taking opioids and who have become opioid dependent. What we try to do, most of them will usually be patients who've either had surgery or going to have surgery. And the surgeons will usually be the doctors who start prescribing the opioids. So once they start, and just assume they come in there opioid dependent, what we try to do again is we try to work on them in twofold. We work on them the mental aspect, and then we work on the physical aspect. The mental aspect is very, very important. We start with that first, because when a person is in a lot of pain, it affects them tremendously. It affects all aspects of their life. So we have to work with that first. And if they've been in pain for a long time and they've been taking the medicine for a long time, that's a little bit harder to do. Okay, but we still work on that aspect first to let them understand that there's hope, that there is a way out. It may not be the easiest route, but if you follow these recommendations, we can get you from a state of dependency to a state of independency. Okay, so one example is a patient who was involved in a car accident. She ended up having to have a multiple level fusion in her cervical spine or in her neck. They gave her the opioids or the heavy pain medication, and she was taking it for about 6 months. So at that point, if you're taking it 3 or 4 times a day for 6 months straight, you're pretty dependent upon the pain medication. So we started working with her with the chiropractic and physical therapy. We were working with her on the mental aspect as far as getting her to do meditation, to do yoga, and to also speak with a counselor about some of the issues she was facing because of the pain. So she was speaking with the counselor as well. We started to counsel her on her nutrition. We started her on a low fat, a high fiber, and a green leafy diet. We started her on that. She started taking supplements over the counter. She was taking arnica, and she was taking turmeric over the counter. These are anti-inflammatory, and they're also all natural pain medication. She treated with us, with our office, for about 3 days a week, and she treated for about 3 months before she started to get significant results. Once she started to get significant results, we started to talk with her about decreasing her frequency of taking the medication. She was taking 4 tablets a day every 4 to 6 hours. So we told her, this one step at a time, drop it down to 3 tablets and see if you can manage the day with just taking 3. She started doing that. We asked her to lower it down to just 2 tablets and supplement it with something over the counter if you need to. It's a process.
Like your Tylenol.
Like your Tylenol, like your Advil. So she started doing this. She treated with us for about a year. Okay? After a year, she was able to go back to work. She works as a truck driver. She stopped taking the heavy pain medication. She only has to take over-the-counter medication as needed, and she still treats with us now.
So that's a great success story for you. How does, as a doctor, how does that make you feel when you have a patient that's come so far and now they're back to normal, you should say?
Yep. As a doctor, it makes it all worth it. It makes it, to see a patient actually follow your recommendations and get the desired results, that's what we're in it for. And it makes the whole process worth it.
So we can combat this opioid crisis.
Yes, we can. Yes, we can. If everybody works together, if we educate the patients as well as educate the doctors who are prescribing the opioids, we can combat this epidemic.
So if you had the power to change anything in terms of helping, our community on a whole to combat this opioid crisis, what would that change be?
I would have to start with the doctors who are prescribing the opioids. I would have to ask them to try alternatives to prescribing the opioids. Or if you do prescribe the opioid, prescribe an alternative in conjunction with it, so that your long-term solution is not taking the opioid forever. That's not the answer.
We have a lot of doctors in the audience listening today, your colleagues.
Yes.
And what would your advice be to them?
My advice to my colleagues would be, educate your patients. Talk to your patients. Give them alternatives. Don't let the first and only choice be an opioid or a heavy pain medication. There's other things that can be done to reduce the patient's pain. Try those other things. Educate the patient that if you do start taking it, that there's a high probability that you can become dependent on it. Let them know the risk that's involved with taking this medicine.
Dr. Thompson, thank you so much for being here with us. I really enjoyed this conversation. I'm Sandy Collier. We'll see you again next time.
Thank you.
In our next session, a one-on-one with the county's top prosecutor.
Well, it's important to know that the opioid epidemic was never inevitable. It was entirely preventable.
Learn how opioids exploded in Florida.
And by the year 2010, we had more pain clinics in Florida than McDonald's in Florida.
The role of doctors in making Palm Beach County a national model.
We depend on healthcare experts, doctors who are at the front lines of this to help us identify the problems.
And the new concern.
You can't fight the war against heroin or oxycodone today, because today the war needs to be against.
On behalf of our organization, we would like to thank you for electing to take this opportunity to learn. We also would like to thank our team and panelists for helping us make this project possible. If you would like more information on T.D. Ward Jefferson Medical Society, please visit our website at tljmedicalsociety.org.